On Facebook, we hear very often talking about the newest concepts in cosmetic surgery. Today, I wanted to demonstrate an injection into the face. This is a patient of ours, Mindy, and what we're going to do is Mindy's concerned about the fold here. There are different options that we can use. Today, we're using something called Restylane, and Restylane is a substance called hyaluronic acid. There are different types of substances that we inject in the face. We can use Restylane, as we're saying today, which is a very nice compound to fill up the folds, often the cheekbones, and different areas where we want to add volume to the face. One other product that we tend to use, Juvederm, is very, very similar. So you may have heard of Juvederm or Restylane. It gets very confusing as to what to inject. So I work individually with my patients to figure out what's best. Now, there are thicker substances also made of hyaluronic acid that we can use. Something called Perlane, or now called Restylane Lift, which does very nicely to help the cheekbones or different folds. There are so many things that we can do now to help the face in terms of adding cheekbones, what I call my liquid facelift, where I actually camouflage a jowl to make it look like somebody had a facelift. We actually can add volume to the cheeks to look like you had cheek implants, or even to the chin to make it look like you had a chin augmentation. If the patient has lip lines, there are other newer products that we can use. Something called Restylane Silk does really well to inject the tiny lip lines, and another product called Bolatero. So there are different options that we can use for the different areas of the face. And it's all about individualizing the injection. So what we're going to do now for Mindy is fill up with Restylane the fold here. That's called a laugh line or the nasal labial fold. And so we go ahead and we give a little bit of a substance here, and it immediately will take away that crease for the most part. Can't take it all away, but it does a very nice job in terms of camouflaging it and making it less obvious. We often can come down to this area here, and this area is called the marionette line, and that also can immediately get better. One of the nice things about the hyaluronic acid products is when I inject, I come up on the face a little bit to give a little prominence to the cheekbones as well. So we're not going to show the full injection right now, but this is a product, it doesn't hurt all that much. We tend to numb the patients very nicely, and it will help to camouflage or take away most of the folds, as well as give a little bit more prominence in the cheek area. So it's all about individualizing the process. The injection is quite simple. It just takes minutes to do. We can also add to other areas of the face. We can use lip injections to give a little lip plumpness, as we've shown before on Plastic Surgery Live. We can give really nice contour to the upper part of the face, or whatever we want to do. Often I'll combine injections with Botox to get rid of the wrinkles of the forehead, as well as laser treatments to tighten up the skin. If you want to come on down to any of my offices, either Woodbury, Long Island, Southampton, Long Island, Manhattan, or Boca, give my office a call. Go to greenbergcosmeticsurgery.com, and we'll see you later on in the week right here on Dr. Greenberg's Plastic Surgery Live.